here's the Board of Examiners website, and these are the licensure requirements. And it does say if you're a licensed clinical social worker, a marriage family therapist, psychologist, nurse. They don't have a CPC, which is what I am, which is clinical professional counselor, does a master's level clinician as well. So you have different kind of requirements, but let's start from kind of going forward. Um, and they have this infographic that kind of shows you the minimum qualifications to be what that you consider a CADCI, the Certified Alcohol and Drug Counselor Intern. That's what the I stands for. You got to have at least 60 college credits towards an approved social science found with proof of current enrollment towards an approved degree. So let's say you got an associate's in human services, like our degree, which is approved. It has been approved by the board. I went and asked their blessing and I got it. So that's within their policies that they've approved GBC's Human Services Program as an approved degree. You have to have at least 60 credits, which would be our master's or right thereabouts. And then that you want to be enrolled in the program still, like towards the bachelor's. Because you cannot become fully licensed until you have your bachelor's. Just realized that I can't see the chat window, so it might be asking questions there. Okay. You have to have a bachelor's or a master's degree. Or the other yeah, so your question is, can I still work as an intern? Yes, you can under direct supervision in an agency that provides these services. Okay, and so the supervisor is a fully licensed drug and alcohol counselor that can be at the bachelor's or master's level, and they have to have the supervisor credential as well. If you have a bachelor's or master's, in addition, you can't have any arrests, convictions, or other legal obligations. When they say that, they mean like, I don't know, like back child support, things like that. You know, they want you to kind of be up to date with all that kind of stuff. So now, if you do have a past, and sometimes people have had encounters with criminal justice system, as long as it hasn't been within 2 years, depending upon the charge, the conviction, then they usually will approve it. A lot of times students will come to me and say, hey, I had some issues when I was younger or recently, and I don't want to discourage you. You might have to explain things. They might give you like a probationary period just to make sure everything's okay. In most cases, they usually will let the supervisor kind of monitor you in case there's an issue there. Okay, so I think we kind of have a range of experience here, so let's try to cover most of it. So let's see. You have to create an account for the portal, and then you'll submit your transcripts, which is important that you get good grades, fingerprints, and a background check. Provide your identification. You have a supervisor agreement in place. That means that you would have, like, I'm a supervisor, so if I was working at an agency and providing those services to that agency, you could work under a supervisor like me. You'd have an agreement either through the agency or directly through the supervisor. You're going to provide a resume, and you have to have completed 6 CEUs, which are continuing education units in ethics and confidentiality, HIPAA, for a total of 12. No more than 90 days prior to submitting your application. So you gotta. They want these to be recent. So even though you might have taken an ethics course, they're not going to count those. They want up-to-date ethics training and confidentiality and HIPAA training. Okay. For the problem gambling, you have to have completed 30 hours of problem gambling course. Now, we have HMS 439, which is a 4-credit gambling course, and it qualifies, and they have approved it. So if you take that class, along with your problem gambling counseling intern license, you can, or your drug and alcohol counseling license, you can get the problem gambling counseling as well, kind of simultaneously. The issue is that you have to get problem gambling clients. So if I were you, because I'm going to be a counselor in Nevada, you're going to run into people with problem gambling. And if you take the problem gambling course from us, you can add that kind of extra licensure to your credentials. Now, while under supervision, you'll need 4,000 hours if you have a bachelor's or below. If you have an LADC is somebody with a bachelor's already, and an LCADC is somebody with a master's. The problem gambling hours is 2,000 hours. That's going to be specifically towards problem gambling, apart from whatever you do, and you have to document these with your supervisor. So you'll meet every week. You'll staff cases. You'll go over ways to help your clients, or if you're working with a group, you might be working with a couple or a family, because you're able to provide these services when they pertain within the scope of practice of drug and alcohol counseling or addiction counseling. So in order to qualify for a CADC, which is removing the I, now you're fully licensed, complete the supervised hours and above, and obtain a bachelor's degree before applying. LADC is complete the supervision hours above and obtain an approved master's degree before applying. And the certified problem gambling counselor completed the supervised hours with additional training. This isn't new to me. Native American alcohol and drug counselors has 1,000 hours plus additional requirements. So you can see that from the 4,000 hours to 1,000 hours and additional requirements. I don't know what those are. This is newer to me. This is not something that I've seen before. I probably need to look into that. And then mental health clinicians seeking an LCADC. LCADC is the highest licensure that Nevada provides. It's a licensed clinical alcohol and drug counselor. And if anybody, we're just a small group, if anybody wants to ask any questions, you can just unmute yourself. Have a discussion. Mariah is asking, you'll need to take another ethics class. No, you'll need to take CEUs, which are continuing education credits. So doctors, nurses, lawyers, mental health professionals, psychologists, and drug and alcohol counselors all do what's called continuing education. So every year or every 2 years, you'll have to submit a report to your board of examiners indicating that you completed, because imagine if you got your medical degree in like 1978, right? And you're still practicing. The things that you were doing, we were taught to do have changed quite a bit, and you don't want a clinician working on you or working with you that doesn't have up-to-date training. So they require you to kind of continually get new training and incorporate new information into your practice. So there are a number of professional associations, like let's say, for example, for psychologists, the APA, the American Psychological Association, they'll hold conferences. They might have online training through their website. You will typically ally yourself with a professional association. Like for drug and alcohol counselors, that's NAADAC, the National Association of Addictions Counselors, NAADC, something like that. NAADAC, National Association of Drug and Alcohol Counselors. And no, I think it was 6 hours. 6 hours of ethics and 6 of HIPAA. And also CASAT, which is one of, they're kind of affiliated through UNR. They have their own training program specifically for drug and alcohol counselors. And I think they have some problem gambling courses and supervision courses, but we do too, just so you know. But they provide CEUs. And you can sign up and take some of those, or you can take it through your professional organization. There are a number of ways to get them. The main thing that you want to see is, is the provider affiliated with your national association? So for like MFTs, Marriage Family Therapists, it would be AAMFT, American Association of Marriage Family Therapists. For mental health counselors, we're NBCC, the National Board of Certified Counselors. Those training providers will apply for basically affiliation to train with their stamp of approval. And typically, not all the time, but most of the time, almost all the time, the state boards will accept the national board's certified training. So that's one way to kind of make sure the training you're getting is going to count towards your CEUs, because not all training meets the state board's approval. And if you have questions about it before, especially if it's an expensive one, you want to ask the board. And you can always call them or email them, typically email them. They're pretty good at responding nowadays. I think they got a little more staff. The other thing is there's some fees associated with it. But one of the things I wanted to mention is that there's all these hours, think about, let's say you're doing the CADC for 4,000 hours. That's basically two years of full-time work under supervision of a fully licensed supervisor, right? Now, if there's some exceptions, if you have a master's degree and 12 credits in drug and alcohol counseling, that can be reduced down to, I think, 1,000 hours. No, 1,500 hours. If you have the bachelor's degree, our bachelor's degree, and 18 credits in substance abuse counseling, which our bachelor's program has in excess of that because it's really focused on that. So you'll only have to do 1,000 hours. So think about that. So who's got the associates? Yeah, okay, so Allison got 4 hours of this last month. You still need 2 more. So keep that in mind, and it's got to be within 90 days of application. So don't forget, they want fresh ones. Sometimes you'll find free ones too. So Mariah has got her associates. If she applied to the board now, she got a supervisor. Where do you live, Mariah? Winnemucca, okay. Is there an agency that does drug and alcohol counseling in Winnemucca? I know I should know, because you might have done your practicum there. Okay. So let's just say, for instance, they have somebody named Joe, and Joe's supervisor, he's a drug and alcohol counselor, he's a LADC, got a bachelor's degree. He could supervise you, Joe could, this is our made-up person. And while Mariah is finishing her bachelor's program, she could be licensed as a CADCI, working, completing the 1,000 hours under supervision, and upon graduation, she will be fully licensed as a LADC, a licensed alcohol and drug counselor. She would be equivalent to Joe, minus the supervision credential that takes a couple of years afterwards. You have to wait 2 years of full-time, being fully licensed, and then take supervision training, and then apply to take a test and all kinds of stuff. Oh, I should, yeah, that's why we have the STEP program we have. We've got the certificate, the 30 credit certificate, which is basically your first year of your associates. If you decide, hey, I just want to work as a paraprofessional in the industry, you've got some training and education that will help you work. If you decide to go on to your associates and complete that, you can apply for your CADCI, and then continue on with your bachelor's, and then you'll be fully licensed upon graduation. So it's kind of like a step-up program. That's kind of why I designed it. And the other thing is you do have to take an exam from the ICRCA or ICNRC, alcohol and drug counselor exam. And then there's an oral exam. And you'll basically, and I'll tell you, because I served on the oral exam committee before, they will basically give you the DSM, which is, you guys should know what that is, the Diagnostic and Statistical Manual of Mental Disorders. And we're into text revision 5, so DSM 5, TR. And they will give you a case study, or maybe 2, maybe 3. And then your time, you have maybe like an hour and a half or something like that. You'll take that case study, you'll read it, you'll develop a diagnosis based on the case study. You'll develop a treatment plan and an aftercare plan for that patient, right? So say, Martha is a 50-year-old female. She's been she says she spends more time drinking than she should. She just got a DUI. She lost her job, and her kids won't talk to her, and her husband threatened to divorce her if she doesn't go into counseling. And there'll be some kind of markers like she usually has 3 to 5 drinks a night. She sometimes gets blackout drunk. All the things, they'll say enough that will give you the ability to formulate a diagnosis based upon the criteria of substance use disorder or alcohol use disorder in this case. And then you will say, based on these symptoms, she meets the criteria for substance use disorder, and let's say moderate, because there's mild, moderate, and severe, right? And say in this case it's moderate because she just drinks too much wine after a soccer practice like that. And and then they'll ask you a few questions, usually related to ethics. They'll review your case presentation, which is your review of the case study, the assessment, diagnosis, and treatment plan and aftercare plan. Okay. And of course, if you go through our program, you will have done this in a few of your classes, right? You'll have done it in probably 105. You'll have done it in 427. You might have even gotten 104. But we prepare you for this. So keep your books. It comes in handy when you're preparing for the exam. You'll of course have to be familiar with the DSM as well. For addiction disorders that are delineated in the DSM. Does anybody have any questions about that? And kind of clear about what you need to do and how to get licensed? The most important thing is that you keep this this website as your friend, right? Now, Allison, if the way I'm thinking is that you probably qualify now. I'm not sure if that's true or not, but it might depend on when your undergraduate degree was in. Now, you don't have to have those extra classes, but they reduce the number of hours you're required to do. So that's really important. Okay. So also, I do have a little bit. Oh, that's a great book. Let's see. I brought up this the handbook for occupations from the Bureau of Labor and Statistics. Kind of breaks down what you need. Typical entry level is master's. That's not true. It's master's. Master's degrees will lead to a higher degree of licensure. And just so you know what a master's does with the LCADC that I mentioned, the licensed clinical alcohol drug counselor, which is distinct from the LADC, which is licensed alcohol and drug counselor. The LCADC, the licensed clinical, means that you can treat people with other mental disorders. Like, let's say they have a co-occurring condition, they've got depression, or they have bipolar type 2 and a substance use disorder like methamphetamine use disorder. Or let's say cannabis use disorder or whatever, opiate use disorder, right? We used to call it addictions. We don't call it that anymore. Things change, and kind of a way to kind of maintain and respect the integrity of the person. We don't call them by their disorder. You don't call somebody cancer, like you say an addict. You say somebody with this disorder, right? Like you don't call somebody diabetes, you call somebody who's suffering from diabetes or has a diagnosis by diabetes. And when people do not make criteria anymore, like they haven't used anymore, they use to a degree that isn't pathological, and they don't meet criteria, they no longer have the disorder. They are not addicts for life. That is a way of thinking that is stemmed from the Alcohol Anonymous movement. And while I applaud their efforts to help people, it is not based in science and research. Is it useful? Absolutely, in some cases. But we do not, as clinicians, we don't use their criteria to determine a person's health and well-being. We use the science and research and scholarship that informs our profession. It's really important that you understand that distinction. And we use clinical language when we're talking about patients or to patients. We don't use kind of, street language, if you will. I hear a lot of old school counselors do that. Back in the day, all you need is high school diploma, went through a recovery program with a counselor, with a mentor, not even a counselor, or not mentor, what do they call them? Sponsor. And you could apply if you wanted to. So you can see where there's a lot of problems with that because you might not be using, your substance of choice anymore, but you can still suffer from a lot of other disorders, and not be diagnosed. So there's a lot of issues with that. Now, not saying that there aren't good old school counselors. I learned from some of the best, and they taught me a lot, and I have nothing but admiration and respect for them. I also saw a lot of people in the field that shouldn't have been there, that had clearly had other mental health disorders and were practicing. The whole point of us professionalizing the practice and the boards requiring a bachelor's now and then really moving towards a master's degree. Ultimately, I think in the next 5 years, that'll be the norm. Just because there's so much education and training that needs to occur. One of the big problems is a lot of drug and alcohol counselors are not versed in mental health disorders. So they will see a substance use disorder when there's a mental health disorder present or co-occurring, right? Now, in our bachelor's program, where you are introduced to major mental disorders, you're expected to review and understand case studies, diagnosis criteria, and then develop a treatment plan. I don't teach that. Dr. Wentz teaches that class, but it's one of the ones I wanted to include in our program because I think it's so important to understand that these mental disorders can influence addictions, and sometimes they are they're comorbid. They're related to each other. Okay. We have the book, self-medicate. Yeah, can be something like that. Okay, so I check out this page if you're really interested in doing this because I want you to be informed, not just kind of like, hey, I want to grow up be a marine biologist, but not really know. I dropped that into the chat, but it goes over what they do. Oh, sorry. Work environment, how to become one, which is different state by state, pay, job outlook. There's lots of good statistics here. I mean, I wish I had known about this. When you're a student, you're so overwhelmed with, what you have to do to get through school. You just kind of pay attention to that. I would still do that as well. So what I try to do is introduce you guys to things that I learned as a professional that I think were really important. That's why you've got a prevention class. That's why you've got advocacy work in your capstone courses. That's why you got program development in your associates and your bachelor's, because these things will be expected of you as you move into leadership roles in these agencies. So you learn how to do a budget. If you take 250 and 450, you learn how to develop a program from inception to completion. You learn how to advocate and deliver presentations to stakeholders who, grant providers, people who provide grant funding, people who might be interested, like the community that can provide real estate donations or building donations to you. Because if you don't know how to talk to people, you don't know how to develop this network and these relationships, it's really hard to get the help that you need to do the mission that you want to do. I know as us, we want to be counselors, but we have to do so much more. And that's just the way it is. I wish it wasn't like that, I also looked up some job announcements for the state. So this is just one that I found. Substance use counselor 2, salary range is 59 to 87. That's pretty good. 33 is pretty high. Directors are about 40, I would say. So really good pay. You get holiday. Take it from me. I'm a state worker, right? I get all holidays. I get paid time off. I get great medical. I have a great retirement program. And sometimes you might think, oh well, I just work in agency or nonprofit. You might, get introduced there, but there's nothing wrong with making sure that you have you're compensated well for your education, training, and the value of your profession. So it's important to remember that. So if you want to move on, there are opportunities. In this case, you just have to have a certified alcohol and drug counselor. So, excuse me, you've only got to have the license. I think that's what they want. That's it. Let's see it. Licensure as a certified counselor in drug, yeah. So you just have to have a license. So in this case, you just need the bachelor's. They didn't put the education because that is a little bit tricky. Some people have been drug and alcohol counselors for a long time when they didn't require a degree. So I think they left it out intentionally so there wasn't any kind of limitation on who they can qualify for this position. It's also important that there's not enough of them, so the state's always looking for folks that can do this job. And then statewide, this one is they have locations in Las Vegas, Boulder City, Indian Springs, Jean, and Henderson. This is more down south, but there are typically ones up north, especially in some of the rural communities that GVC students live. Okay, there's also, I looked up some other ones here. There's jobs in Reno Sparks. It looks like Indian Colony. I don't know where that's at. Looks like Reno, but I'm guessing there might be a reservation or some in that area.
A colony, a colony is when you have uh, a group of a group of native people within a city, so it's not separate from.
Oh, okay, so it's not like a reservation where it's segregated from the community.
Correct.
It's part of it. Well, we have, I would say we have those here in Las Vegas too, because they're over on Main Street downtown. There's like, I would say a neighborhood basically.
Mhm.
Okay, so just letting you guys know there's opportunities here. I also looked up some federal jobs. There's a ton of them here. This one is a substance abuse assessment counseling in Okinawa, Japan. These are civilian jobs. They are not military enlisted or positions. And I actually had one before I came to work at the college. I had a contract with the Marines to work in Iwakuni, Japan, and it paid a lot more than that. And I was, I'm always surprised to find that most mental health providers have very little experience and training in addictions because it's the second highest disorder that will be diagnosed for mental health, right? So number one being depression, and then number two being addictive disorders, and that doesn't necessarily mean drug and alcohol problem, gambling, sex, working. There's all kinds of manifestations of addictions and how they kind of they present themselves in patients. Here's a senior social worker, substance use disorder specifically. That's pretty high salary, but that's going to be a master's level. Vice president, mental health counselor, substance abuse, and GS 9 through 11. Those are high. Like, I think I want to say a 14 or 15 is a general. I don't remember what GS stands for, but it's a pay grade basically. So there's lots of opportunities. That was my hope is I don't want everybody to turn into social workers, but it's also there too. They also, for psychologists and psychiatrists, and I would say most doctors, when they go through medical school, MDs I'm talking, have maybe, if they're lucky, a semester of substance abuse. And so they're not good at identifying, diagnosing, or treating it. And they could be psychiatrists, you know, unless they decide to specialize in it, and there isn't a lot of money in that. People tend to go into the profession or the specialties that pay more, like plastic surgery or something. I don't know. So after you've gone through our program, you know a lot more than most professional mental health providers about substance abuse counseling, diagnosis, and treatment. And there's something to be said for that. One, we're not paid as well as we need to be, but if you get your foot in the door, you can tend to get pay raises pretty quickly, especially if you're good at what you do and you have the other management and supervision training that we provide. We also have a course in supervision too, HMS 499. I think we had to cancel this semester, and we canceled the problem again because nobody took it. So we had on the catalog or on the course offerings, but it was empty, so we dropped it. But it's something to think about. If one or two students, we typically want more. I'll keep it open. My boss doesn't like it, but she'll let me do it. She knows I want to grow the program, and so does she. So, okay, with that, is there any specific questions that you have for me?
Um, I'm having difficulty with the online format. Um, do we have lectures?
We will have a couple lectures coming up. The they're called the Human Service Symposiums. I think the
Mhm.
first one is in sometime this week, this month. I want to say the 22nd. We'll have an open lecture. You should have it should be in one of your assignments in your online course curriculum, and then we'll have another one in November. But we don't have traditional lectures weekly like in person. These are all online.
But are there lectures that I'm supposed to be finding online?
No, no,
Oh, okay.
yeah, just follow the course material.
Okay.
Yeah, it
I
would be really late for you to, I'm glad that you asked the question, but no, we don't typically. Now, next semester in the spring, we're going to hold a hybrid course where we have weekly lectures with online course material. But having said that, that's going to be for 116 only. We're going to probably try to rotate that so we have more lectures more often. But what's happened in the past is the students don't come because they just want the online, um, you know, they're used to it. That's the mode of education and what they're used to. And any other questions?
so I tried to sign up for 4.99 this term, but it disappeared. Um, so if I sign up for that for spring term,
We only
as
offer it in the fall semester.
ah, then
Yeah.
no, I won't be doing that.
Yeah,
Um,
so you can try in the next fall. But it's not required for the degree. It's kind of an extra course. But it will give you the supervision training that you need to become a supervisor. But you're probably gonna want to take that after your license because they want to see that training more recent. If that makes sense. They're gonna want to see when you.
oh, so it's not that I'm having somebody supervise me, it's that I'm learning how to supervise someone.
Yes, yes, you're
Oh,
gonna
light
be
bulb coming on.
right. Yeah, so that's to train supervisors for training supervisees.
Oh, cool.
Yeah. And anybody have any other questions? Please ask now. Here, no, there's no silly questions, just the ones you don't ask. Okay, so um I did drop that link in the chat. So take a look at that because that's going to be the most important one for the drug and alcohol board. No, I didn't drop that in there. Hold on, let me do that right. You're going to want to get to know the NRSs and the NACs. I don't know if you guys know what those are, but they're the laws that dictate our licenses. So, and they change. So keep track of those specific legal codes because they affect your license. The board is not there to interpret those laws for you. The board is there to protect the public from you. So they ensure that you're qualified, that you're ethical, that you're competent in your field, and they give you that license, which is a privileged license to have, because you've demonstrated that. And anytime you violate that, they have the authority and the right to remove it from you. So it's really important that you know those rules. So a lot of times when I'm training interns, they'll ask me, they're like, "Well, you're the supervisor." I'm like, "Yeah, I'm the supervisor, but you're the licensed professional. So go look up the code, read it. If you have a question about it, I'd be glad to discuss it with you. And if there's something we don't understand, we can ask somebody else. But really, this is not written like a language that is not intelligible. It is written to be understood generally as a law, and it's important that as professionals going forward that you know that that's your responsibility. Because if you ever do something and you say, "Well, I didn't know that wasn't considered unethical conduct, or I didn't know that was outside of my scope of practice," they're not going to say, "Oh, it's okay that you didn't know." They're just going to pull your license, and then they're going to force either for you to go through remediation or start your training over again. They're going to say, "Obviously, you're not trained well enough, so you're gonna have to go through another training program. And they can do that. And I've seen it. And all of the meeting minutes for the Board of Examiners meetings, the quarterly meetings, are all public online. So if you get sanctioned by the board, if your license is suspended, everybody knows it. It goes into a system that every Medicaid, Medicare, all insurance companies can access and look at that. So it's so important that you take the ethics, the professional practice really seriously, because I would hate to see any of my students end up in that situation. And I haven't for the most part. To be honest, one of the board presidents, past president now, had come to me. I was at a conference, and you were asking about CEUs. These conferences, professional conferences, you can get CEUs. And that's really the main thing is we get together, researchers come, they present the research on our topic, we listen, we gain CEUs, and so you're getting the latest, you're getting stuff that's not even in the textbooks yet. You're talking stuff that's papers that were just published recently that scientists and researchers and academics are providing. So it's really interesting to go to these things. Luckily, as an academic, the college pays for me to go to those things because that's part of my job. So I get to travel and go to these things all over the place, sometimes different parts of the world. So it's pretty cool. But when I was strictly a clinician, sometimes my job would pay for them. Sometimes they would host trainings at my site so we could get our CEUs. There's lots of ways to do it, and it's really a great part of the experience of being a professional. But back to my story here, one of the board presidents stopped me at one of the conferences and they're like, "Are you Professor Sheet?" I was like, "Yeah." And she said, I always know when one of your students comes before the board, before even looking at their their transcripts." And I said, "How's that?" And she said, "Because they always pass the oral exam proficiently." And that's because we have those two courses that teach you guys exactly, I mean, literally, that was my intent. Like, you are going to know how to do this before you graduate. And so it's not a surprise. But I had gone through my master's program, and diagnosis was not really strongly emphasized. Psychopharmacology wasn't either. Pathology was not well defined. We focus on counseling skills and practices, but we didn't focus on a lot of stuff that's really required to get licensed. And at the master's level, it's even harder because there's another exam, and it's a bear. It's like 10 or 11 uh, case studies. They just give you like the backstory, and you have to, based on reading that, you've got to come up with the clinical diagnosis. And they try to trick you, like, well, if you don't know the difference between acute stress disorder and PTSD, and that there's got to be over 12 months of persistent symptoms, you're going to choose the wrong diagnosis. And they're trying to trick you. They're really, I had to take the exam twice. And I don't take any exam twice, but in my life, that was one exam I had to take twice. The drug and alcohol exam, I didn't find very difficult. The books that you guys get will be enough to study with. There was also study guides too. But as long as you did well in your courses and you remember them and review them, you'll do fine. Bone up on your ethics before you go to those exams, of course. And then talk to people that have taken them recently, say, what's it like now? Because the exam changes like every year. It's rewritten. They change the questions, they change the format sometimes. But so Allison, yeah, we don't have typical lectures like when I was in my undergrad, but we do have these big lectures where we all come together. So you'll see like 70, 80 students on at the same time on a Zoom meeting like this. And I think Dr. Wentz is going to be providing a lecture that evening. And then we have a special guest in November. We have a published author that is going to be presenting on her book about public speaking and things like that, which I thought was important for you guys to learn how to do. So. And don't forget, if you haven't taken practicum yet, you're interested, we're going to have a practicum orientation, so you know how to sign up for the course, how you look for a practicum site, how you kind of familiarize yourself with the whole process, because it's not like taking a regular course. And you'll get I already sent an announcement early in the semester, but I'll remind you, it should be, no, it's not in your. There's no assignments listed for it, but we'll send more. Yeah, you're welcome. Anything else, folks? Okay, well, thanks for your time and attention and interest. And good luck with the rest of the semester. If there's anything you need, don't hesitate to contact me or Dr. Wentz. We're always here at your disposal. Everyone have a good evening. Bye.